I am so thrilled that you're here, Stephanie Faubion. First of all, Dr. Faubion. The idea of, first of all, you look incredibly young to have done everything that you're doing. But when I think about you and the research that I've done, the sort of the aging, menopause, sexuality, female issues, topics, and these are hot topics. I just want to jump right in and ask you, nobody can better describe what they do than the person. So people ask, tell me who I am, and I went like, why don't you just let me do it? So I'd love you to talk about what you do so that then when I ask questions, they'll kind of be understood.
Wonderful. Well, I'm trained as an internist, and I actually trained in pediatrics as well, but didn't end up practicing that. I now am in administrative leadership and have a role as chair of the Department of Medicine at Mayo Clinic in Jacksonville. But I am also a women's health doctor, and I didn't start out intending to be a women's health doctor, but life just pulled me in that direction, and around early 2000s got very interested in it for a number of reasons. But we started a clinic and a registry of women being seen for menopause concerns at that time. That registry has been going on for many, many years now, and we have probably 12 or 13,000 women who have been seen. So we've done research over the years in women with menopause concerns, and that sort of evolved, and the answers led to more questions, and we kept going from there. And so we've got an entire team working around this issue now. So back in the day, even just about 5 years ago, say, you couldn't even beg anybody to talk about menopause.
Yeah.
But now, fortunately, I think we're starting to have that conversation. Otherwise, I never would have been here with you.
It's very interesting. 5 years ago, I thought, we have to start talking about menopause. I'm 78, and so I started HRT when I was 46. And I thought, there's a lot of mystery attached to this. If you don't talk about it, it becomes a difficult topic. And now there are so many experts on menopause that are like 50 or 48, and I think, wow, that's fascinating. How did you become an expert? Because it's the trend conversation, as you know, which is all good, because then people like you who are not just sort of in the moment with the hot topic, but who really do research, can tell us what menopause is really about. I want you to really guide the conversation so that it sort of makes sense, and of course I'll be asking questions, but I think if we can just get menopause done and out of the way, then there's all the surrounding things that I think are really critical, that the second part of menopause, sex, sleep, health, all of that we can really dig into. But just take us through menopause.
Yeah, that's a great way to put it, although I don't know if we're ever really done with menopause. So
never.
Right. So the definition of menopause is no menstrual cycle for a year. Most of us are lucky enough to know when that happens. Some of us have had a hysterectomy and wouldn't know because you don't have that cue of having monthly bleeding. But perimenopause is that time that leads up to the last menstrual period, and that's a time where ovarian function isn't quite 100%. Can be good some months, not good some months, lots of hot flashes some months, but other times no problem. And that can last 6 to 10 years before the last menstrual period. So this transition, as we call it, can last quite a long time for women. We used to say, oh, hot flashes, night sweats, don't worry about it. It'll last a year or two and be done, and you know, pat you on the head. But we now know that the mean duration of hot flashes and night sweats is 7 to 9 years, and a good third of women will have hot flashes and night sweats moderately to severely for a decade or longer.
So how do they expect us to be in a good mood when we're having hot flashes? I mean, of course, I'm sure millions of people have said to you, could you imagine if men had to go through this? Because they couldn't. I mean, we have an incredible ability to tolerate discomfort,
Suffering.
and still move on. It's a real... Not that it's something we want to sort of cheer on, but it is a sense of the strength of women. It's incredible. So if this is about hormone depletion, is that what you would use that word? And the hormone irregularity, obviously. When women are experiencing this, I think I'm around a lot of people in different age groups, and the 40 to 50-year-olds are questioning what's happening. Is it menopause, or is it something else, or is it because I'm anxious about something? Yes, you're anxious, and it is because of all of the above. But what would you suggest? I mean, I'm sure this is a common question. What would you suggest someone in their 40s who's feeling some irregularity, maybe not in her period, maybe there's no sign of change? What are the telltale signs?
That's such a great question. You know, it was only 2 years ago now that a wonderful study was published that showed us that women who are still having regular menstrual cycles could be having a lot of symptoms related to the menopause transition. And before that, we said to women, if you're having regular menstrual cycles, that's not the problem, which we have learned is not the case. And so it's not uncommon for women to come in saying, I'm having some of these same symptoms that menopausal women report, but I'm still menstruating regularly. And so it just is that combination of that the timing's right, the woman is of the right age, et cetera, and having all the classic symptoms. So hot flashes, night sweats, maybe having some mood disturbances, and a lot of women report anxiety symptoms or irritability. Also sleep disturbances, even without night sweats, just having trouble getting to sleep and staying asleep. Women can start to have vaginal dryness during that time. So there's a number of symptoms, but sometimes it's hard to tell. So some women may have heart palpitations and maybe gaining some weight and maybe losing some hair, and all of that is associated with this time as well, but we can't rule out, you know, a heart problem. We need to make sure we're not missing other things during that time.
So you just described gaining weight, losing hair, feeling anxious, vaginal dryness. This is not a happy person. So relationships definitely have to be challenged at this time, and we know that it tends to be the time when relationships are challenged. And I feel like this conversation is such an important part of what we're going to talk about, because I'm in the business of making women feel good, look good, feel good about themselves, be healthy, eat properly, work out, do all of that. And then this thing hits, and even if they are, it still is something that is happening to them. And so your optimistic personality can get challenged. So what's your experience with women dealing with that, or how are you sort of addressing that part of it?
So I think part of this relates to the fact that women don't know what to expect. They're not anticipating that this is going to be a thing. And so they're coming in to me, they're often coming into me as an internist, not as a menopause doctor, but saying, I don't know what's happening to me. All these different symptoms are happening and it's not making sense to me, and I think there's something really horribly wrong with me. And so I think part of it is a lack of education that, we give girls the talk
Yeah.
before they, they're in 5th or 6th grade.
Right.
We don't give 35 or 40-year-old women the talk to help them understand what will be happening to them or what could happen. Not to say that every woman struggles during this time, because certainly some do not. I think when we talked earlier, I described that my mother didn't understand why I was writing a menopause book, because she said, I don't understand what the deal is. And I said, well, what was your experience, Mom? And she said, well, I may have had a hot flash once at a cocktail party when I had a glass of wine. And I went, So
Interesting.
For most women, that's not the case. Most women struggle a little bit more. So I think, one, educating women about what can happen and reassuring them that what they're experiencing is normal per se, if not acceptable, and we wouldn't say, pat you on the head and send you out the door, but can happen during this time, and that there are things that we can do about it, and there's no need for women to suffer.
Yeah, I think having solutions is a big part of this. I think a lot of women believe that they're not going to be the ones that are affected, and they also believe that they can ride through it. But you know what, I can ride through it. And I've had friends who are telling me this, and they're sweating in front of me. I'm like, no, actually, I don't think you can, because you look like shit. You don't look happy. You're like, you got to deal with this. And the minute they do, it's like amazing magic. And they feel like themselves again. They look like themselves. They're really optimistic. It's the optimism that I find the most important for women. So what are some of the solutions?
We generally think about it in terms of when a woman's in my office, what are we trying to fix here? So if it's the mood issue that's the biggest problem, then we might address that in a different way than we might address hot flashes, for example. So for each woman it will be different. Certainly hormone therapy is an option. It's probably the most effective therapy that we have to manage hot flashes and night sweats, also manages sleep disturbances, some of the mood issues, a lot of the other things that women go through, vaginal dryness as well. But it's not to say that it's the only solution. So some women can't or don't want to use hormone therapy for one reason or another, and so we do have other options out there. So I want women to know that we can help them even if they choose not to use hormone therapy.
But they need to deal with it and not sort of barrel through.
Well, so that's a good point, because a lot of women think, if I can just make it another 6 months, I'll get through. But when I just explained that the hot flashes and night sweats last a decade or longer for a third of women, barreling through may not be the best option.
I know. I keep saying it, like, stop. I mean, you've got to. I just had lunch with someone and had this conversation, and you just want to get them into another place, because it is extremely uncomfortable. And if you're in a relationship and sex is like being attacked by a terrorist, because there's nothing about your personality that is ready for that, and you don't even want to think about it because you're so uncomfortable in your own skin, that is part of relating in a relationship, and it is so important for your own self-esteem to feel good about the body you're in. And I think for me, I was so lucky to have a doctor who was way ahead of his time, and especially if you think I was 46 when I started HRT, and now I'm 78, and I know how lucky I have been. I am aware of it. But there were years when I spoke to doctors women doctors who didn't want to recommend it because it was too controversial. There was so much data that misled what could really be the answer for so many women. So now there's more data, and each individual, talk about that, the individual, and how we're all so different, and we have to not use a general rule.
Yeah, that's a really great point, because each woman brings their own medical history and family history and personal preferences with them, and that's something that these are hour-long conversations in our offices when we talk about hormone therapy, because there are so many details that we need to discuss, and women need to understand what the risks and benefits are for them specifically. And so we talk about past medical history and reasons why women wouldn't be able to use hormone therapy, such as a history of a blood clot or a heart attack or a stroke or a history of breast cancer. But there are, as you suggested, many women out there who have been told that erroneously that they can't or shouldn't use hormone therapy, and I think that it goes back to a lot of misinformation that's out there. And we're referring to the Women's Health Initiative trials that were published initially in 2002 and another in 2005, and so we've come around almost full circle after understanding and analyzing the data and looking at it. And for those women who are younger, so under the age of 60 and within 10 years of menopause onset and have bothersome symptoms and don't have any of the things we just talked about, the benefits typically outweigh the risks. So there are many more women there that are probably candidates for the use of hormone therapy than are actually taking it. And hormone therapy use in the United States went from about 40% of postmenopausal women using it to about 4% over the period of just a couple of years because of fear. And I think we've come back around a little bit. I haven't seen any data out recently about whether that's increased at all.
I'm sure. I think because the conversation is more upfront, and I'll be more specific about my case. I'm taking hormone replacement. I have it reevaluated at different times, like, am I taking the right amount? Is this what I should be doing? And then I have very dense breasts, so I've been having sonograms and ultrasound, whatever, on top of mammograms every 6 months, because I really want hormone replacement in my life. I've enjoyed that relief through all of these years, and I really think it's worth taking the extra time to have extra checkups and be vigilant. And I think my individual case is just mine. Everybody will have their own story, but I think more discussions with experts like you, so that the correct decisions are made, are really critically important, especially when you're feeling insecure about everything, right? Your judgment isn't exactly right. You're feeling sort of out of sorts with yourself. I think getting guidance early when you start feeling something, just find out, even if you're not 100% sure, I think is a recommendation.
You make another good point about not feeling good about yourself or feeling insecure, and we just published a study this last spring that showed that women are actually experiencing adverse outcomes in the workplace, and they're missing work because of menopause symptoms. And we did a calculation on the economic impact just in the United States alone is almost $2 billion a year, but if you add in medical expenses related to that, et cetera, we're costing the United States about $26 billion a year. So this is not small, but you also think about the individual woman who may not have taken a promotion, who might not have applied for the next job, or maybe stepped down from the next job. And what does that mean for her personally and her career development? But what does it also mean for her retirement? And so I think when we need to step back and really consider, what is this doing to us as a society when we're dismissing women's symptoms during this time? They're not being addressed in the workplace. Employers aren't savvy about it. They're not asking the right questions. They're not providing the right support. But I think the other big issue is that medical providers are really not educated about menopause in our training programs, and that any education has pretty much dropped out of training programs for a number of reasons, including there's so many topics to be learned that menopause is just squeezed out.
Well, that's why we're having this conversation, because I believe and very strongly in the conversation we just had, that what you talked about in the workplace. Women are obviously a stronger presence, more important positions. A lot is changing. But when it comes to those years, those menopausal years, whether it's the feeling of it happening and this discomfort, or actually in it, or how long it can last for different individuals, it's all sort of a combination of stories. But I want to make a point about this, because I believe, and from a longevity and aging perspective, that when I turned 50, and I really believe that starting hormones before that, when I realized I needed them, it was incredible helpful to me, because at 50, I made decisions about the rest of my life with a long game plan. It wasn't a short game plan. It was a long game plan. And I'm 78 now, so 28 years later, I am starting new projects, doing new things. I never felt pessimistic or that I couldn't. Now, it isn't all HRT, but it's allowed me to really fulfill what my purpose is. And I feel there are so many incredibly brilliant women like you and the other doctors that are doing this research and providing information, that I want you to be doing this for a long time, because the longer you do it, the smarter you will be, even smarter than you are now. I am so smart now, and so much wiser, and I have a perspective that I never had before.
Right.
I don't want people to miss that in their lives, right?
Exactly, and I think, well, you need to give yourself some credit too. So I think part of this is your own personality and not the hormone therapy, as you suggested. But I think women need to be empowered to really take control over their symptoms at this time, and not just assume that they have to be a victim to them, right? Which is not true.
Yeah, and unfortunately, there is an aspect of our personalities as women where we allow ourselves to be victims. We're becoming more aware of it, but there is some aspect of behavior that's passed down to us that we feel being the victim is part of what we should be, and that's not true. It's just not acceptable.
Yes, I agree, and I hear women who have been to medical providers who have told them that their symptoms weren't severe enough, or they didn't warrant the use of hormone therapy. So in essence, being dismissed for their symptoms, and I think women need to be advocates for their own health. And if they're taking the initiative to go to a physician's office to talk about this problem, it's probably a big enough deal that they need to be taken seriously.
Or they need something, and I absolutely agree. If you're going to go talk to someone, that time is incredibly valuable for that woman's life. I think there's the other part of this relationship thing, which is not really talked about as much when you talk about menopause. But relationships are incredibly important in our lives, and they're hard. I mean, I just have to say, having a relationship takes a lot of work, but if you feel fat, and I mean that in just the most gross way, like just not feeling fit or feeling, but if you just feel like fat means I don't feel good about anything, right? Those 3 letters represent a whole state of being. You don't want anybody putting their arms around you or touching your stomach. It's like, why are you touching my stomach? And I don't like, what are you doing? Like, so can you imagine how you have to figure out how to have a relationship, or do you care to if you feel so bad? Like, so what? If this isn't working, I don't care. But then there's so much at stake. Mm-hmm. And so how do women deal with that? Are you aware of any of that part of what's going on?
Yeah, sure. We actually published a study a few years ago called the MATE study, and it looked at partners' views of the menopause transition. And guess what? Partners were just as bewildered by the whole thing as women were, but wanted to be helpful, wanted to understand what was happening. And so I think it's really important that women have those discussions with their partners, educate themselves, but their partners need to understand what's happening too. Mm. Because I'm sure it's bewildering to see a woman you love and all of a sudden they're irritable and anxious and don't seem to be the same person anymore, and having hot flashes and night sweats, and really, like, I have women in my office going, I want to kill my family right now, so I'm sure that doesn't go well at home, let alone the sex part of it, right? Yeah. So, and the good news is that for women who have enjoyed a healthy sex life for their whole lives, they're very likely to continue to have a healthy sex life, but sometimes it takes some action, like managing vaginal dryness and being a little bit more planful in terms of sexual activity.
Or knowing that they can manage it, that they can control, or just some sign of, like, you can this one you can figure out, this can be helpful. I remember it's very often women that are going through menopause may have daughters who are going through puberty. So I remember when my mother was going through menopause, I was a bit past it, and it was the longest menopause, I think, on the planet. And I remember going through puberty, and then I was like 17, 18, 19, and her menopause just seemed to never end. And it was intense, and it was so intense that I actually got married at 19.
Because of your mother's menopause?
It was so intense. It was, I realized when I was, I sort of worked it out in my head that this is what I needed to, but it was really, I was never planning on getting married. I thought, I need my career, I need to do this. And then I realized it. And then later on, when she was older and she never, of course, dealing with hormone replacement or anything was totally not in anybody's conversation. And I had started taking hormone replacement myself, and I spoke to her doctor and I said, I am begging you to please consider HRT for my mother. And he did, and her personality turned around. She was funny, she was so sweet. We had the most affectionate, loving, sweet, and again, not that it's for everyone, but I knew from the beginning that this was not the woman that gave me so much, that was so creative, inspiring, and this was not the same woman. And her life could have been so much happier, but that generation didn't have the information, right? So we have it now. And so what do you recommend if someone's turning 40? So there's somebody I spoke to today who's turning 40, and she was asking me, she's working on this project, she's asking me, so what do I start to think about? And I thought, this is a good question for you. So somebody's turning 40, no signs of anything. How do they start educating themselves? Like, what are the first steps? Maybe it's even in your 30s. Where do you kind of start figuring out what's about to happen?
Great question, and I think we need to educate women starting in their mid-30s, to be honest with you, because if anything after the age of 45 is considered normal for menopause, most of us, the mean age is about 52, and most of us have gone through by 55 or 56. So if you back it up and say women can start having symptoms 10 years before that, 45 is normal, then 35 is when women may start having symptoms. So I think education is key. It doesn't mean any action is required, but understanding what may or may not transpire during this transition, so women know what they might have and know where to go to get help if they do. So it's not like we're telling women they need to proactively get on hormone therapy. That's not true. But if women have symptoms that are bothersome, they should seek out some care and seek out some knowledgeable care.
Right.
The Menopause Society, menopause.org, is a really great resource.
That's great.
For women who are looking for somebody who is knowledgeable. We actually certify menopause practitioners. And so they're all across the country, and women can find somebody that's certified near you. So again, most medical providers do not receive education in menopause management. And so if you're hearing something from your medical provider that's nothing can be done, or it sounds like you're getting blown off in terms of your symptoms, then you should probably look for some different care.
Yeah. And then I think there's a good conversation about being fit, working out, eating healthy food, and I really want to have a conversation now about alcohol. I wrote in my book, against my publisher's guidance, that I should not mention what I felt was important to mention, that I feel women have a harder time dealing with alcohol, and that we have to be really careful and know our bodies and know what we're doing at a young age. And I have seen the way alcohol literally ages women. I mean, it just, skin, face, eyes, the whole thing. And I'm thinking, if you look like this, it's like having too much salt, or it's like having the wrong food. You look horrible. You look terrible. So it's telling you something is not right. And I think there are certain foods and things that we can talk about that affect how you're feeling through menopause or even before. But I think alcohol is really something to think about, maybe not indulging in at a certain point in your life, depending on you and your personality and how you can deal with it. But I think it's something to consider rather than, oh yes, it's okay, have this amount. I just don't think there's a general kind of, yeah, for women it's okay.
Well, a couple of points there. So women don't metabolize alcohol in the same way that men do.
There you go. Well, thank
you. And so weight for weight, a woman of the same weight as a man is not going to metabolize it in the same way. So we do handle alcohol in a different way, and that's why the recommendation for women is less than it is for men. It also may worsen menopausal symptoms like hot flashes and night sweats. It also disturbs sleep. So there's a number of reasons why a menopausal woman may really want to watch her alcohol intake, because it can make some of these things worse than they are. Also consider women are at that time where kids may be launching, they may be going out with friends more, going to cocktail parties more, and so alcohol intake does tend to go up around midlife for some of these reasons. So it's important to keep tabs on that, and for some women they really ought to probably cut back for a number of reasons, not just because of menopause symptoms.
Yeah, I think it's really a conversation worth having, and when I first did the book, it was a little controversial. It would be the first question. I think I'm being interviewed about this book. I have so much good kind of meaty stuff in there. It's like, do you really think? And I'm like, okay. Actually, I don't think it's a good idea. But I do think that should be a conversation that is more open, and that women, especially going through menopause, should know about. One of the things I think about in the life of a woman is that hormones really are a constant for us. You know, obviously monthly, we're having hormone fluctuation. From the time we go through puberty, we have monthly, and then we have, so you have a baby, and then boom, nothing, and then up again. So, or you have 2 babies or 3 babies, and there are all of these things that are affecting our hormone levels that are going up and down. And in some of the worst descriptions of women, we're described that way. Our personalities are described that way. When somebody really wants to try to take us down, they define us by our hysteria or our lack of evenness or whatever it is. While I don't think it's a terrible thing in some cases to have some of that, I do think there's an aspect of that we aren't really that in control of, because controlling our hormones is just sort of, how do you do that? It's a necessary part of being a woman. What are your thoughts about that? Is there any conversation or studies?
Well, I think that's a big question. So if you consider it, that our bodies are built this way for a reason. We can produce a baby, and our hormones are regulated so that we can do that, so that we can ovulate once a month, and
right.
Either it's fertilized or it's not fertilized, and if it's not fertilized, it's cleaned out and we can try again the next month. So our bodies are meant to do this. Mm-hmm. So it's not like that needs to be fixed in some way. We've got a pretty good system working there.
Right.
But you have to remember that those hormones and those hormonal changes are important for who we are, and they're going to impact every aspect of our bodies, right? Every tissue and organ system is influenced by hormones, and estrogen specifically. And so when we think about our metabolism of medications, for example, we're different than men because we have those hormones on a regular basis.
Right.
And so when you think about the fact that drugs weren't even tested in women for that very reason, is because we had these monthly fluctuations in hormones, and goodness, we could get pregnant, you know, and we don't want to get pregnant and be on a drug. So for that reason, we've ended up where we are, and that is, we don't know that these drugs are as effective in women as they are in men, or we might have side effects that men don't have.
Right.
Or, you know, the test for heart disease may need to be different for women, and the treatment for different things, including cancers, may need to be different for women. But we're not exactly looking at all those sex-based differences that we need to look at. And we're just at the very beginning of starting to figure some of that out.
Interesting. I also was told that twice as many women than men have Alzheimer's, and that there may be a correlation to hormones on that. What do you know about that?
So some of the researchers at the Mayo Clinic are actually looking at that and trying to sort that out. So there's a couple of factors involved. One is that women live longer than men, so more women are going to have it because of age alone. But even if you control for age, there seems to be a little bit of a female predominance. So what is the reason for that? Is it related to hormones? Does giving hormones back after menopause make a difference? There are researchers that are actively looking at those questions right now, and we don't have all the answers for that.
Well, I find that interesting, because personally with my mother, I saw that this awareness, and so when I heard that this was being looked at, and that was a possibility, I was like, I'm so not surprised. I'm absolutely looking forward to seeing what that data presents for women to think about. Also, when they're thinking about making the choice of hormone therapy, that how it can have a long-term effect on how they function and how their brain functions. Like you said, it affects all of you.
All aspects.
Yeah.
So for dementia risk specifically, we know that if you go through early menopause before the age of 40, that's premature menopause. Early is before the age of 45. We know that estrogen is definitely beneficial for the brain if at that point.
Right.
So you're at increased risk of dementia if you don't use
Yeah.
hormone therapy. For women who go through between 50 and 60 at the average age, it appears to be a neutral effect.
Mm-hmm.
For those women who start it after the age of 65, there seems to be a harmful effect
Really?
associated with hormone therapy. So it is time dependent. And we call that the timing hypothesis. So how old you are and how close to the menopause transition is really important and probably influences what hormones are going to do for you or
Wow.
not do for you.
Yeah.
Right?
Yeah, and again, it's so individual
It is.
to find out all the time what's happening. So I think another part of what you do is the aging aspect of women's health. And also to just talk a little bit about the fact that you really are being specific about women's health and women as a gender, what we experience, and which is really great because so much testing is done on male mice and so much research is done through a male perspective that having a unique, focused interest in women as a gender and the physical experiences we have is really fantastic. So thank you for that.
Yeah.
It's a wonderful thing, right? So tell me about how you got interested in that.
Well, I think, menopause is one thing. That happens in midlife. You have to understand that we are going to spend a third to a half of our lifespan after that. And so we look at the menopause transition as sort of a time where women go through an accelerated risk for future disease, and specifically heart disease. So with that menopause transition, we tend to see our blood pressure drift up a little bit, blood cholesterol looks worse, we tend to gain weight, we have more diabetes, and in general, our heart disease risk goes up. We're at greater risk for sleep apnea. So it's really important to take that menopause transition as a time to sort of reset, recalibrate, understand what your risks for chronic disease are, and to intervene. And you've emphasized lifestyle change as a way to combat that. You can't overestimate that, the importance of that. And so I think it's really important for women to know that they have some control over this, and they have control over their own lifestyles, and regular exercise is a key factor in terms of not gaining weight over time, and managing your stress and helping your lipids and your blood pressure be better. So, and then diet is super important.
Yeah.
So there's a lot of things that we can control to help us age in a better way. We're all going to get old. None of us are going to survive this thing and come out alive at the end. All of us are going to die at some point. But the key is to have a healthy health or a long health span, not necessarily lifespan, but we want a good health span to where we end up being healthy until the very end, right? And we can do what we want to do.
Yeah, and everything that I research and people I talk to about longevity, there's the three pillars of a healthy life are sleep, diet, exercise, and then it sort of goes through different iterations. And as you get older, exercise is clearly number one. And I think I find exercise so empowering on so many levels, because when you know your body can do something, even if you wake up stiff or you feel, oh my God, getting out of bed this morning is not so much fun or whatever, the minute I stretch and the minute I do the things that I know are going to loosen me up, I feel in control, I feel good about my body, and I feel healthy because I can do the things with my body that I've always done. And it's primarily because I work out every day, and it's sort of a prescription. And obviously we work out here for the prescription to be shared by my staff as well. So what kind of data exists, or what do you know about how exercise sort of helps the longevity, or is part of that? What is the proof of that?
We know that exercise is good for pretty much everything, except for hot flashes. Doesn't really help so much with hot flashes, but it helps with pretty much everything else. So we know it helps you not gain weight. We know it helps reduce risk of heart disease. It helps reduce risk of cancer. So exercise, if there is a fountain of youth out there, not so much the hormones, it's really the exercise.
Yeah.
Truly.
Yeah, I agree. I think so. And I think one thing that I've become aware of is I always had great balance. It was always like I could, really feel quite comfortable doing anything that had to do with balance. And I noticed as the years go by, balance becomes more and more of a challenge. And so when we're doing all of these pretty rigorous exercises and the balancing part comes in, or when I do yoga, the sweat, I'm drenched. Everybody looks at me at the end of the class like I'm drenched, because the focus to balance is so challenging, but clearly balance is critically important.
It takes a lot of muscle control to balance.
It's and what used to be easy is not so easy. So there's something happening. Do you know what that is?
Well, I think it's a combination of things. Having just done a dance competition where I used to dance pretty much for a living,
really?
and my vestibular system, I was getting dizzy really easily.
Really?
So I think we have aging of a number of components, and I think part of it is we lose muscle mass. We don't have as much core strength, for example, and so there's less forgiveness in terms of maintaining balance. And I think it's really important to maintain your muscle strength as you get older, because that's what's going to keep you from falling. That's what's going to keep you out of a nursing home.
Yeah. I think there's some other aspect of it, because I can do everything else, but
I think there's some in the brain probably.
I do.
Yes.
I do think it's a brain thing. I think there's something here, because I'm telling it, come on.
And it's just not happening.
Hello.
I would agree with you, but I don't have scientific evidence for that.
But I feel like it's that. But clearly, every time if I'm putting on water for tea, I'm standing on one leg. Whenever I have a chance to stand on one leg or do some yoga pose, I'm gonna try to do it, because the idea that I can't is just like, this is not good. We have to get this under control. So clearly, if you're 30 or 40, working on building that memory in your head for balance and for all of these things is a really good idea. The from a longevity perspective, what are the top hot topics that are now sort of in research or in what you guys are doing?
Well, I think there's a lot we don't know and a lot we need to look into that we're just starting to figure out in terms of, what we eat, how does that impact our gut microbiome, and how does that affect the aging process. So there's so much that we just don't know. But I do think we're starting to learn, just how important mood, sleep, regular exercise, like we've talked about, all of these things impact our bodies in so many ways that are going to impact the aging process and how we deal with that. I think we're learning a lot from the blue zones where people live to over 100.
Yeah.
And, what are the characteristics of those people? We just had this conversation this afternoon. A lot of them live on this island off of Italy where it's incredibly steep and they have to go up and down, the huge hill every day.
Yeah.
Yes. So I think, and they eat fish and they have olive oil, so a really healthy diet. So I think there are pockets that we can learn from. There's also probably genetics play a role. But I think, again, a lot of it is under our control.
Yeah, I also think staying involved in everything is really important. And especially as women, I think when women feel they don't look as good as they used to, and they don't feel they can do anything about it other than looking like an avatar or some other, witness protection program thing. I think when they feel that way, they sort of remove themselves from involvement with other people, and I even hear women in their 40s saying, I'm old, and I was like, what? Yeah. What? The minute you use that word, you've decided, you've given yourself a label of how you should behave and who you are and what you're doing, and it's like, never act your age, never succumb to a belief system. That just doesn't have to be. And I think that there's probably data about thought process and reality.
I agree. Also, you mentioned staying engaged, staying involved, staying busy, staying active. All of those things are part of, feeling that you remain relevant. And I think that's so important for everybody as they age, but for women in particular to remain active. And, the second you give up and go home and sit in the rocking chair, that's kind of the end. So I think do what you enjoy doing, even if it's not what you did for a living. Is there something new you want to learn? Do you want to learn a new language? Do you want to take on a new job? Do you want, something? But keep learning, keep moving, keep doing new things.
So at the Mayo Clinic, tell me a little bit about the kind of research, like the approach to research, especially for women's health. How does that all work? It's not my world. I don't understand any of it, but I'm really curious.
So there's research going on in so many different pockets, and research can be bench research in the lab, and really looking at how aging cells what they're influenced by. But also, one of the strengths that we have at the Mayo Clinic is we see a lot of patients with a lot of different things, and we have these registries that help us sort of track a large number of people over a long period of time, and that's how we can pick out, groups that have done one thing versus another and figure out the differences between them. And so I think Mayo is unique in that way. We have a lot of these patient registries that we can really dig into and look at specific disease entities. And so we also have a lot of collaboration. We have multidisciplinary teams, and so it really helps to put those bench researchers next to the clinicians in the office. So the clinicians in the office go, here's the problem we're seeing in the office. What do you think we can do to look into that? And so when you have that kind of tight collaboration, that's what really can accelerate things and allow us to move things forward. So I think research is in a bunch of different pockets, but when you have the clinical practice informing the research initiatives, that makes all the difference.
So if women want to know about specific issues, is there some way they can do it through the Mayo Clinic, or like to get information on latest news, or if you have a new reports or data about something for women, is there some way that women who are just interested can find that?
It's a great question. We certainly have, the mayoclinic.org has all kinds of information about what's out there, what the latest is, and that's kept up to date. But if women have interest in a particular trial, we also have ways for people to access. Do you have a trial in this particular thing? And we can give women information about that. But in general, mayoclinic.org is probably the best way.
And then the sexuality. Tell me about that aspect of what you work on. What do you cover? What have you researched? What kind of data have you?
We've looked
gathered?
at all aspects of that, mainly within our data registry on the experiences of aging, menopause, and sexuality, or DREAMS is what we call it. But we've looked at things like, what does BMI have to do with sexual function? We've looked at adverse childhood experiences in sexual function. We've looked at a history of infertility and sexual function. We've looked at menopause and the impact of that in sexual function. So really a lot of different things that we've investigated over the years, and really a lot of great findings. But the thing that we do this in practice every day. We practice sexual medicine, and we're helping women of all ages, from 18 to, we've seen women in their 90s.
Yeah.
About how do we help with a particular problem, and so it's again our clinical practice that helps inform our research.
So in some of the research, you said early childhood experiences. What are some of the examples that might affect sexual behavior?
So we know that women who've experienced adversity in childhood, and that can either be a parent who was in jail, or emotional neglect, or verbal abuse, or even sexual abuse or physical violence, have more sexual problems later in life. And that's really not that surprising.
Right.
They also experience more menopause symptoms, and there may even be an association with the timing of onset of menopause because of the chronic stress.
Interesting. And then what are some of the other findings that in the research as far as sexual behavior and in an adult?
We've had a lot of variable findings. In general, psychological health has a lot to do with sexual functioning later. The presence of a partner has a lot to do with whether a woman remains sexual over time. So mood and the presence of a partner are two of the biggest factors.
And I think sexual mores have changed. They keep changing and sometimes becoming more confusing or less strict or more open. And I remember, as a baby boomer, we decided that as much experimentation as possible was really what you did. I mean, this was just a switch from everything that had happened before, which was just the absolute reverse. I mean, I didn't think I could live out of my home if I wasn't married, so I got married. So that was the mentality. And then all of a sudden, there's this complete reversal. And I remember being with a group of women in California, and they were always more experimental than New Yorkers. And so everybody was having a mirror looking at their vagina and to see what was going on. It was the first time. That's not what women ever thought about or did, but we went to this extreme of like, okay, we're going to have a party and have these mirrors and look at our vaginas and see what was the same or different. I don't know if that happens today, but at the moment it was, we need to know everything. We have to experience everything. And so we're in a culture today where social media, pornography, so much affects people's point of view about sex and sexual behavior. How is that affecting women's health and attitude towards sex now?
I don't know that I have a lot of experience on the effect of pornography on women's sexual behavior, but the changes.
Yeah.
The women who are in my office are not the ones that are looking at their genitals with a mirror. Often, and I actually have a hand mirror in my office that I use to help women look at their genitals, because many of them have never looked at their genitals.
You're keeping it alive.
Yes,
I
exactly.
love that.
Exactly. So I think what I see is mostly the opposite, as women haven't had a lot of sex education, don't know what's different about their genitals because they've never looked at them before. So I think we still have a long way to go.
Yeah, and I think the sort of the relationship with sex as individuals and the comfort and I think it all goes back to how we feel about our bodies, right?
Yeah.
I mean, it really, if you don't feel good about your body, it's not, you may not want to take off your clothes. Never mind engage.
Having sex, yes.
Right.
Well, so I think the important thing there is women are sexual beings. We're all sexual beings. Women do remain sexual until the end of their lives if they have a partner and if they're not depressed. And so I think it's important to consider. Now, sex is going to look different when you get older. So it's not going to look the same at 80 as it did at 60, and it's not going to look the same at 60 as it did at 40, and back, it's not going to look the same as when you were 20. But that's probably a good thing in many ways.
Yeah, but also, again, exercise has a lot to do with
health in general.
How you feel physically about engaging, and it does change, but it's not. It's really such an important part of how we communicate too. So I think having more discussions about that as well, and I just think it's more like watching The Bachelor or something like that than really having a conversation about intimacy. It's that we're at that level where lots of girls are watching The Bachelor, which I think I saw about 2 minutes of and thought, I don't think I can engage in this, versus
actually talking about intimacy.
Intimacy.
And having a conversation with your partner.
Yes.
Believe it or not, many people have not. So I think that's a good place to start.
But I also think women should have those conversations too, because if you're comfortable with the conversation, then you can have it in a relationship easier, I think. I think it becomes part of, okay, this feels good, it feels comfortable.
And it's an important part of life. And guess what? It relates to health too.
Yeah. It's exercise.
It is part of remaining healthy over time.
So tell me what you think my audience is, I've been doing this 56 years, so I do have a broad age range, but I do, at this point in my career, have a good population of women who are in their 25 to 45. That's a big bulk of who she is. Sometimes she's anxious to find the mate or find the partner in her life, and so she's single and sort of curious, concerned, the world is so uneven, and then there's the next level of that. And so there's a lot of concern for this age group, because going through COVID in your 20s has got to be probably one of the most difficult, because you're identifying who you are, you're having relationships. What's your view of this, and what kind of advice do you have for this group of women? And then we can even take it further in conversation.
Wow. Well, I'm not a relationship expert. Let me just say that.
But
I do have 3 daughters who are in that age range, 24, 26, and 28. So I think you're right. COVID was this very stressful time, and it's challenging to find a relationship that works for you, but you have to find somebody that makes you happy and that makes you comfortable, and then the sexual piece fits into that as well.
I think the relationship part I mean, for me, I'm going to get married finally in a relationship that's right for me, but I'm 78. So a 28-year-old may feel like if it's not tomorrow, it's the end of the world, which is crazy. But I think for her, for these girls, and sexual intimacy is I think part of the learning process. And what are your thoughts about that at that age?
Well, I think the intimacy part is very important, and women typically don't have sex without the intimacy part being important. You can, of course, but I think at the end of the day, for satisfaction, the intimacy part is key. And, I think finding somebody that you have that with is very important. Now, again, I'm not a relationship expert, but I know it's difficult for young women out there.
So for the sexuality in that age group is really sort of the beginning of the experience of figuring out what works for you and
who you are.
Absolutely.
Right.
Who you are and how you how your self-esteem is communicated is critical. I think that's the big important concept to have. Self-esteem will bring respect, and then you can enjoy a sexual experience when you know that that's part of the interaction.
100% agree.
Yeah. I knew it would be great spending time with you, and thank you so much. But I think we have so much more, and any information that people want, we're going to give them through recommendations that you might have for us. And thank you so much. I'm really, really thrilled that we had this time together.
Thanks so much for having me.
Okay.